we are really keen to know about your journey, sir. What really inspired you to do something which was so new and novel to homeopathy and homeopaths at a time when homeopathy was so less known to people and just known as more of a myth or placebo. And so, yes, we are
Yeah.
really keen to know that.
So thank you very much, Meghna. Uh, let me start by saying that I belong to a family of homeopaths, like does Dr. Shankaran. So my father was a homeopathic doctor, and I actually the principal of the college. So I actually took to homeopathy because it was the easy option for me to do. My son is a homeopathic doctor as well. So we have about 135 years of homeopathy in the family. So I really took up homeopathy because it was really an easy option for me. But once I got into the system and the study, I found it so magnificent and so fabulous that I made sure that I kind of studied hard and actually then started training myself and learning also from my seniors all the clinical aspects of homeopathy, and then getting good results. I started my practice in a free charitable clinic, earning only 150 rupees a month, and that's like about $1.5, $2 a month. And from there onwards, it was a very difficult time actually, and I'll give you one or two reasons for that. So the first thing is that the category homeopathy was not recognized very well.
Yes, Dr. Mata.
Thank you, Manish. Thank you for coming back. So the category homeopathy was not recognized very well because people had a lot of misconceptions about it. It was believed at that time that to prescribe white pills, you need to have gray hair. And if you didn't have gray hair, you couldn't prescribe, and I was a 23-year-old, 22-year-old when I passed out. That time it was a 4.5-year course. And I started my practice when I was 23 years old. So I also had a credibility issue with youth, with somebody being young, when the profession was kind of expected to be somebody who's very senior, very old, and things like that. So that was a challenge to start with. The other issue was lack of capital. So medicine was not recognized as an industry at that time. Forget about homeopathy. So no banks were willing to fund you. So when I started my first clinic, I had to actually borrow money at 36% per annum, which was a very, very high rate, of interest. And it took me 10 years to repay that loan to start my first small little clinic in Mumbai. So I think it was always very challenging. I think all of us homeopaths are, I always say that, we are the second largest system of medicine in the world, according to World Health Organization. So we are challenger medicine. So anybody who's challenging number one always has a larger role to play. It has to be very, very, pugnacious, very tough, very strong, and has to kind of go against the flow. And it's only when you do that, when you go against the flow and, when you are tough, that's really when you can get somewhere. So I think starting was always difficult. I think it's difficult for all homeopaths when they set out on their own. But things are much better now. There's a greater acceptancy of homeopathy. It's already the second largest system of medicine in the world. It's growing 25% back to back all over the world. So there's great growth and awareness, mainly because people are fed up of the side effects of chemical medicine and they're looking for safer alternatives. And they're also moving towards holistic care and towards wellness. So the whole industry and the whole, all the people are actually now moving from sickness to wellness. And that's a very strong, kind of status and a kind of a platform which homeopathy can occupy, because with its holistic medicine, it can actually prevent disorders as well. So now preventive disorders rather than treating sickness is the mantra of the day. And homeopathy is very, very well positioned to actually deal with that.
Dr. Batra, I'm very sorry for the technical glitch I had at the beginning of this session. It's a pleasure talking to you. And what is important for me to know is, because we are talking today for the benefit of the young students, the people who have just started the journey in homeopathy, what they can learn from your journey. So what is important for me is not what your path to success is, but what the person is behind that success. So I would like to start and go back a bit. Both your parents were medical doctors. Your mother was a doctor and your father was a homeopath. So was there ever a divide in your thought process whether you wanted to become a homeopath or an allopathic physician?
So, as I say jokingly that, I'm a product of mixopathy. So I had my mother was an allopathic doctor and my father was a homeopathic doctor. So I'm a mixture of both. But there was never any divide, because as we were growing up, we were seeing the kind of cases my father cured. I would meet his colleagues, his contemporaries, and get inspired by them as well. So I think the kind of the weightage was really towards homeopathy all along. As a matter of fact, even when we were kids, I used to make medicines for my dad as a dispenser. I started my life as a compounder and a dispenser for my dad. So I got used to all the names of the medicines. And I remember that, whenever we had to, tell somebody what was not a nice thing or abuse somebody, we'd say, hey, you're a sulfur patient. When we would fight amongst each other, as young kids, we would always say, oh, you're dirty, you're filthy, you're sulfur, get out of here. So I think that was really the kind of upbringing with which we were brought up. So clearly, I'm saying homeopathy was a winner at home. There was never any problem. My mother was into administration. She was the deputy director of health services in Uttar Pradesh, one of the largest states in the country. And then ultimately, she devoted her life to charity, and she was in charge of a diagnostic center, and she also converted to homeopathy. So ultimately, I think both my parents actually practiced homeopathy.
Okay, so it runs in your blood.
Yeah.
So after studying, I believe you studied at CMP. You did your graduation from CMP. What made you stick to Mumbai rather than going back to your hometown, Lucknow, and practicing there? You came from a well-off family. You could have had a very good practice back in your hometown, but you decided to stick in Mumbai and practice in a charitable clinic for so long. What made you take this decision?
So I think everything was circumstantial. It just happened by chance. I don't think there was any planning in that, because my father had moved from Lucknow to Bombay as the principal of the college where I was a student. And so the family was settled here. So it was much easier to settle within the family. And of course, I was very keen that I wanted to branch out on my own. I had experienced saying that, medicine is something you can't inherit. I'm saying you can't pass it on from father to son or from one generation to the other. Everybody has to have their own status. I mean, I've seen some very, very well-known doctors, not in homeopathy, but even in medicine. And, the children are always compared to, the father was much better, So it's always a challenge in the same family. So I wanted to branch out on my own, which is why I joined a charitable clinic, to learn from another senior homeopath, also to get a little bit of, deeper insight into somebody else's method of prescribing. So I started my entire career with constitutional prescribing, single dose, and I still practice that even after 45 years. It's still the same thing.
So that's an amazing thing, because what I see, I've seen, I won't say criticism, but a diverse opinion that the kind of medicine, the kind of homeopathy that Dr. Batra doles out, you often get criticism from within this community, within our community, that it's not ideal, it's not homeopathic in its true sense. And I know you have to deal with people outside or our brethren also, and you have to deal with this criticism also. How do you deal with this?
I think after some time you become thick-skinned. I think you just know that what you're doing is right, and you believe in yourself. I think if you believe in yourself and you know that what you're doing is right, like I said, from day one, we only practice Hahnemann and homeopathy, and not me, but all my 400 doctors across the world, practice exactly the same thing. So we don't use mixtures, we don't use compounds, we don't use, we wait for the reaction of the medicine to come. We then go into a second prescription. So I'm saying it's really classical homeopathy that we practice all through. So, I mean, I don't see any reason for, and we have a very transparent system of treatment, because everything is computerized in 1982. We were the world's first computerized and branded clinic. So since 82, everything is on a system. So there's no coding that is done. I mean, everybody knows what medicine is being given, including the patients. So
I'm sure this will come as a shock to many people, because
so there's total transparency.
Many people do not know that Dr. Batra's gives classical homeopathy. So that's something very heartening to know, Dr. Batra. Now, another question that brings up.
I just want to reassure you that, for especially the young people, there's this huge sense of urgency, and we tend to think that if you use mixtures, we'll get better results. But, then there's no difference between allopathy and homeopathy. When you're using a paracetamol, what are you doing? You're again bringing the fever down, you're reducing the pain. It's again temporary. If you're using a mixture, you're doing exactly the same thing. You may alleviate the system, but you're not getting to the root of the problem. It's very important that you get to the root of the problem. Now, for that, you have to understand the entire constitution of the person. You have to get what we call the core of the remedy. So once you find the core of the remedy, then you're treating the person from within, and you're then treating him from the root, and that's how you'll then actually get a possible cure. So I think it's very important for young doctors at least to understand that there's no difference between using mixtures in OTC homeopathy and in versus whatever OTC medicines are being used in allopathy. Okay, they may have side effects here, there may be less side effects, but what are you doing? I also believe that ultimately, if you do too much of it, you're actually creating a drug miasm in the body of the patient. So the patient will go to an impossible cure. You won't be able to cure him at all. He's just going to be palliated.
So that brings to me a related question, Dr. Batra, that you have more than 230 clinics now and more than 400 doctors are working with you. Homeopathic education in India is still not very standardized. It's not very good quality. The homeopathic students that are coming, they're often not able to prescribe at a holistic level, at an individualized level. They often resort to shortcuts, therapeutic prescriptions, polypharmacy, complexes. How do you train these people to ensure that there is a standard quality care available throughout Dr. Batra's?
That's a very good question, Manish. And, first let me start with saying the selection of the doctor is very important. So, we actually select doctors from the 10 top universities or colleges in India, even from some of the smaller ones. And they go through a kind of an MD level exam, to make sure that the clinical, that their knowledge of clinical medicine is very strong. Because we believe that if they're not strong in clinical medicine, then they cannot be good prescribers. That's point number one. Second thing is that we also judge them for their skill in homeopathy. Now, again, in homeopathy, we try to judge how much of practical experience they've got, because theoretical experience is quite different from practical experience. The third thing, what we do is we put all our doctors, before we take them, they also undergo a psychometric analysis, because they may be very good doctors clinically, very good doctors medically, but they also need to be good with people, because ultimately it's they're dealing with people all across. So if they're not people friendly, if they don't know how to deal with them, if they don't know how to face people, so it starts with so normally I would say about 1% or 2% of all the doctors who apply to us, get a job with us. And they are with us for the last 15, 20 years. The average age of the doctors when I started my company was 23 years. We took up all young people from colleges and then trained them. Now today they are 45, 50. I call them the sandwich generation, because, now they have to look after their children and they've got old parents. So they're stuck in the middle, but they're doing so well and they're with us for a long time. So what we do is, so this is the first part. The second part is then, we have a lot of internal training as well. So something which is called CME, which everybody knows, medical education program, continuous medical education. We have at least 100 to 150 hours every year of this training. Now for this, I've created a masterclass and it's on the intranet and everybody can start using it and they can start, we've got something also we call like, how to select the right remedy, how to go to the core of the remedy, So all of that, there's a lot of training that goes in. And it's a continuous training. The training is not only by us, it's also by international doctors. So, for example, dermatologists, the president of the Dermatology Society of Europe, because we see a lot of skin patients, that person came to India and trained our doctors. And not only that, we also have, Dr. Shankaran's company coming and changing us. We're training us in homeopathy. We've had, Dr. Thore's people coming and training us as well. So we are open to outside people coming and training our doctors as well. So that way they get a different perspective as well. So I think continuous training is really the answer. And then, kind of brushing up. Medicine is outdated so quickly. When I was a medical student, I never studied chikungunya. I never knew what was COVID. None of us studied COVID, but it came and we have to learn how to deal with it. So I think it's very important, therefore, that you continuously update your knowledge. And, this continuous knowledge updatation. And, I believe that people don't leave us, not because of money, which is also important, but I think they don't leave us because then we have a very strong knowledge management system. So because that kind of knowledge that we give to them during the 10, 15, 25 years that they are with us, they probably will not get that much anywhere else. And if they had to, then they have to pay for it, a lot. So I think that comes to them as a bonus. And it keeps them, it's very important that doctors also should be intellectually stimulated. And that's what we keep doing all the time. We have best practices. So they share cases with each other every month, across board, across all countries. So there's always a learning process. So I think learning and relearning is really the answer. And of course, the other second part, which is, also because of IT, because of standardized processes and systems. So because everything is IT driven, everything is, the part of artificial intelligence, you're using software, which is, special to us. It doesn't allow you to move to the next field unless you've done your basics, right? So for example, if you have a patient who's losing hair, just a lady, and it's CTE, and she's getting hair loss, and that 60% of India in bigger cities is anemic if they are women. So if the doctor has not done the ferritin level and not recorded it, it will not allow the doctor to go into the next level. The system will stop it there. So I'm just giving an example. It's a very casual, simple example, but like this, measuring medical outcomes of patients. I went to Harvard when I was 60 years old and was one of the oldest students that did a course on medical excellence. So one of the challenges there for the medical profession was, how do we measure medical outcomes objectively? So, using all of that, using processes, systems, using, TQMS, somebody mentioned on the chat right now. I'm saying all of that, strong management systems to actually enhance the knowledge of our doctors. That's very important. And then pass on that knowledge to the patients and let them benefit from it. Because otherwise what happens is that even though you have 400 doctors, there's only one doctor treating you. So it's not fair to the patient that the knowledge of one doctor is availed of by the patient. It's important that one doctor gets the benefit of a group of doctors. And so there's an escalation matrix which is there in the company. So if, for example, a patient comes and after 2 visits, he or she does not feel better, it automatically gets upscaled to a senior mentor. And they will then intervene, and they will re-study the case, talk to the patient, reanalyze it, and re-prescribe.
Investing in the manpower is probably the best thing that any organization can do. And it's good to see that Dr. Batra has invested so much in the manpower, and there's such a good retention. So, Dr. Batra, you just spoke about creating systems. And I'm sure that without these systems, nobody can have such a level of expansion that Dr. Batra has had. Homeopathy is known to be an individualized therapy. So at what point of time you felt that you could branch out from your one clinic that you started? When did you have this idea, this eureka moment that, okay, now is the time for me to branch out? And what did you think? How are you going to manage 4 clinics, 5 clinics, 10 clinics? How did the systems come into place? What was the journey like in developing those systems?
So you said, eureka moments. I was having a bath and I jumped out of my bathtub. And I said, wow, eureka, here it is. That's not true at all. It didn't happen at all like that. Okay. Everything happened by accident. So what really happened was that I already had a set practice in Bombay and I was doing well. And then my son became a doctor. And when he became a doctor, I did not have enough money to buy property for him or a clinic for him separately. He could have joined me. But I moved out from my father and I practiced on my own. I didn't want my son also to be with me. I wanted him also to have his own identity. So I wanted to set up a clinic for him separately. I couldn't afford Bombay. And then that time, Bangalore was a bustling clinic. It was growing. One of my brothers was a builder there. So he said, I'll give you payment terms. You come there. So then over the next 1.5 years, I managed to set up a clinic there. And then I started a multi-city practice. I would practice 20 days in Bombay and 10 days in Bangalore, personally. And fortunately for us, that did so well that then my son didn't have to go to Bangalore, and then I could send a doctor there. And then I could replicate that. And then gradually I was able to withdraw myself and then see patients once in 3 months, and then ultimately then leave it to the doctors themselves to treat people. And similarly, the second clinic also happened in Baroda. One of my lady doctors was there and she was getting married. And she said, sir, my in-laws will not allow me to work anywhere else. They only will want me to, only unless there's Dr. Batra's. You open one in Bangalore. Why don't you open one in Baroda? Today now, 20 years later, that's one of our star clinics. So that also happened by accident. I think I want women to be financially independent. So I try to help them out in that sense. So that thought came really from there. So I think, if you have good thoughts and good ideas, ultimately something good comes out of it. And then everything else evolved. So once you had 2 clinics and 3 clinics, then you realize that you can't function like that. Then you need an IT system. You need a strong IT system. So I invested in an IT system. I made my own kind of CMS program with professional people. And we then kind of expanded it. And then every 5 years, we have to keep changing it because it gets outdated very soon. So a lot of investment in IT that goes into this kind of a network, upgrading it, changing software, licenses for so many things. It's also very expensive, as you know, but it's worth it. So I'm saying then the process and systems kind of set in because you then realize that, you want to be transparent. Now you can't be transparent if you're depending on individual people. So every paisa and every pound and every rupee and every euro that comes into the clinic is recorded live. And the top management gets an MIS live. So we can close all of our balance sheets on 31st March of all our companies because it's all there. So I'm saying this is what, so you're able to use IT to grow, and you're also able to use IT to build a transparent system. Now that's very important because without a transparent system, you can't grow.
All right. For the young audience who is here today and people who are big dreamers like you, a lot of aspirations, and they want to chart out on a path which is similar to you, to have more than one clinic, to have a multi-city practice, or probably have a chain of clinics. what advice would you give them, how to start and how to build upon their practice?
The first thing is nothing succeeds like hard work. So let me be very, very candid about that. It's good to dream, so one can, dream in the clouds, but one has to keep one feet on the ground. So if your feet is not on the ground, you can't do anything. So let's be realistic. Don't be too over ambitious. Don't think that you can make whatever these, we started the journey probably 2000, of starting multiple clinics. So it's now been 22 years. In 22 years, we now have over 225 clinics in 7 countries. It's a long period of time. Nothing happens overnight. So the first thing is be patient, be focused. As they say in Hindi, lage raho munna bhai. Just be with it. Okay, go with the flow. But it doesn't come easily. I'm saying you got to be very patient. You got to let me give you my example. That when I started practice, when I was even well known in Bombay, but when I started practice in Bangalore, actually patients would ask me, they would say, okay, you have reputation in Bombay, but whom have you treated in Bangalore? So unless you have your own ambassadors of faith in the market, which takes for chronic problems, it takes a long time, So it's not easy. So I'm saying you have to be patient, you have to be persistent. They say perseverance is the key to success. And lots of young people, they falter very easily. They'll try for 1 year, 2 years, then it doesn't work. Then they say, okay, let me try something else. I think you have to be with it. So I think you have to have a vision. Okay, you must persevere that vision for some period of time, not just very short. And then, of course, you have to develop then processes, systems, and train people, and it can happen.
Yes,
I'm sure anybody can do it.
That's such a good advice that you have given to the young generation, because people do get restless these days. They don't realize, they see your success, but they don't realize the hard work that is gone behind it. They don't realize that even you had to practice for 20 years before you opened your first alternative clinic in Bangalore.
Yeah, and the most important thing is, you have to make sure that when you're doing this, there's no dilution of your brand and there's no dilution in the services of the patients. So how do you make sure that you're able to standardize? So you've been a very good doctor. You worked 10, 20 years. You made that happen. But you go to some Jhumari Talaiya place or somewhere, beyond, and then that service is not there. The treatment doesn't come. The results don't come because you've got some other doctor who's junior. How do you manage that? So I think that's a challenge. So unless
that is my last question to you, doctor.
Okay, sorry.
How do we standardize?
Like I said, you standardize through the right people. You standardize through processes and systems, by putting them all together. And you standardize through training and retraining. I think these are the three very basic things, And then, of course, we have lots of other complicated things, which I don't want to talk about here. But since you touched that subject, we have internal audits regularly, which are medical audits as well, process audits separately. And then we have some American company which does mystery customers for the last 15 years. So they go in as a regular customer. They don't know who it is. Okay. But sometimes some people are very, very smart and then they come to know that, this is the guy who's come from the company. But, we try and get some unknown people to visit a clinic. And then we get an entire feedback on what the experience was, how the doctor was, did the doctor talk properly, was his queries answered, even up to the point, was the air conditioning good or not, was it too cold, was it too warm, were the magazines torn in the waiting room, was the toilet clean or not. So all these things come in a matrix and it comes to top management and then we act upon it. So I'm saying it's a very complicated, complex kind of design that comes out once you actually get into it. So there's a lot to be done, but like I said, lage raho munna bhai, just keep at it, and I'm sure you'll get there. Don't give up. Kadam choom leti hai manzili aake. Kadam choom leti hai manzili aakar agar rahi khud apni himmat na haare. I'm sorry I said that in Hindi, but I know you've got a lot of international people watching this. But it's really about perseverance. It's really about having a belief in yourself, having a belief in your system. I think what happens is if you don't believe in our own system, how do we pass it on to others?
Absolutely. So right.
So I think believe in yourself and believe in your system. If you do that, everything else will fall in place. Don't worry about anything else. Just go out there and get it.
Amazing advice, Dr. Batra. I would have loved to have a very long conversation with you because I'm sure there's so much to learn from your experience. But we have a time constraint for today, only a half an hour slot, and I'm sure that there's time for the next speaker to join in. I would surely catch up with you some other time to have a longer chit chat. And thank you so much for your time today. It has been a pleasure to have you with us today, sir.
Thank you very much, and thank you to everybody, and thank you for this opportunity. Thank you. Stay blessed.
Thank you.
Thank you.